There have been lots of studies done. Most of the studies have shown that the anesthetic is probably the worst part, but on a scale of 1 to 5, with 5 being horrendous pain and 1 being no pain, it's usually between a 1 and a 2 is what most guys rate it.
And that's what you mean is the pain during the procedure.
Not even just the pain of getting the actual anesthetic. Once the anesthetic is given, and I always tell my patients, once I've given you the anesthetic, you should not be feeling anything sharp or really uncomfortable. And if you do, tell me, because I will give you more. This is not, I don't look at this as a test of strength or willpower or how much you can put up with. I always tell patients, we're going to tell your partner that you suffered greatly. No worries. Okay. So we're going to play it up. I'll write extra things on their discharge instructions about how they can't do anything around the house for a few months or no childcare duties. But really, the goal is to make this as painless and as we don't want it to be a horrible procedure.
Understood. That makes a lot of sense. So assuming they're, hopefully they're not feeling any sharp pain down there, anything like that. Are you feeling anything during this procedure? Do you feel any pressure? Like what do you, like at the dentist's office, I get numbing medicine and they're doing, let's say, a root canal. I'm still feeling things moving around and pressure and pushing. What are we feeling during a vasectomy?
So there's certain things you can't numb up. You can't numb up that pulling or tugging sensation. If a patient tells me that they're having a really bad squeezing sensation, like somebody's got their testicle, squeezing, I'll stop and give them more local, because you can usually numb that up. But I think the initial discomfort of somebody kind of pulling down there or tugging is probably the worst. And again, for most guys, they say it's really not that bad. One of the things that I try to do is I always examine my patients in the office before I do the vasectomy to give them a sense of, here's what you're going to feel. And some men do not tolerate isolation of the vas very well, or they may have a very difficult exam.
Yes.
So I'd rather identify those guys ahead of time and, give them some IV sedation with an anesthesiologist as opposed to, torturing them in the clinic. But I would say that that's way under, 20% of my patients. It's probably closer to maybe 10%.
Agreed. That makes a lot of sense. So it doesn't sound like it's too terrible during the procedure, but how long does the procedure actually take? How long does it take from start to finish?
For most experienced vasectomists, it's about 15 to 20 minutes. You can do them faster if you're motivated to do so, or you can take longer. With my practice, I have 2 different rooms. They can't turn the rooms over any quicker than every half hour. So 15 to 20 minutes works out well for me. But I do know some very busy vasectomists who probably do, 3 or 4 an hour.
Wow. That's quite a turnover. That's for sure. So, okay, let's say I was brave. I'm a superstar. You put in my discharge summary that I got 3 stars for Medal of Valor for my efforts of getting my vasectomy. What am I going to expect walking out that door from your office?
So walking out the door, not much, because you still have the local anesthesia. I use a mixture of lidocaine and bupivacaine. So lidocaine is immediate action, but only lasts for about 30 or 40 minutes. Bupivacaine, though, is a longer acting anesthetic, lasts for typically around 4 or 5 hours. So you should be able to get home relatively pain-free, throw some ice or, frozen peas on the area and start taking anti-inflammatories, ibuprofen, Tylenol, that kind of thing. So that I tell guys they're going to be achy. You shouldn't have horrible pain. It's more an achiness like you got hit there yesterday. And so they're still kind of sensitive. Something happened, but it's not like terrible, gut-wrenching, doubled over kind of pain.
And how long is that achiness expected to last?
Anywhere from a couple of days to a couple of weeks. Everybody is different. One of the things that I really make a big deal of is wearing good support. So we give everybody a jock strap, but compression shorts work well. The more support you have, the better. And sort of the analogy that I use is, think about two bowling balls suspended by ropes. If you fray that rope a little bit and the bowling balls are just hanging, there's going to be a lot more tension on it than if you bring them up so that there isn't quite as much tension and inflammation on the area that you work.